is the opening of a conversation. It starts growing trust and relationships, and that takes time because the people we look after are really untrusting. So a hot meal and a bit of company, even a touch on the hand, when they're having a cup of tea, that's the opportunity for engagement, and that's then we can build those relationships. So food is the start of it. It really is the start of it. So January 2017, I set up Newbury Soup Kitchen, 2 hours a week, pot noodles, tin soup, fruit and bread. And very quickly it became apparent that there was such a need locally to feed, support, and just give the outreach that people needed to move them forward. And it's wonderful seeing people move forward and getting clean, getting off the streets. Today I've actually heard of one of my clients who was a heroin addict who's just got a job today, and that will give her a concrete future. We've got 4 sessions a week, 3 are food provision and 1 is an outreach where we do eye tests. The community nurse comes, we fill out forms, help people with universal credit, PIP applications, getting them into properties, helping them with their licence agreement forms, all that sort of stuff.
Our evening food provisions, from my point of view, are where I can really kind of meet people where they are, and it can be more social. And then I can find, how are you getting on? I can follow up on things. Is there something that I need to do for you in the week, or what are the dates, what are the deadlines for that sort of thing? And then I can start making plans, and then, do you want to meet me this day? A lot of the people who might come to us don't have a lot of control over things in their lives. So it's not that, I might go shopping and I can afford to, they can't necessarily make those choices. So a lot of it is this kind of stress stuff that even the rest of us find difficult. And also they might not have the skills to know what they're meant to do. So it isn't just about food, is it? There are so many other things that we can do. We have a health outreach clinic on a Tuesday afternoon where people can come, I can sit down with my computer there and I can, bring me your paperwork, let's do it, let's make those phone calls now.
The outreach is endless, really. Getting somebody close for an interview. There are charities out there, but we can support with that. A phone if they need it, a SIM card if they need it. We can carry on, it is endless. But today, for instance, we had Julie came in. She spent all day cooking, getting the food ready. We've had donations from supermarkets come in that have had to be sorted. We either cook with that, we cook it down, we freeze it, we donate. Some of it's come here tonight on the van. We have committed ourselves to the vulnerable in this community to help them, keep them fed, keep them cared for as best we can. Last night we fed, I think it was 27. And we got through, they had jacket potatoes with beans and cheese. We gave out 30 of those, plus all the Greg's donations, so a lot of baguettes, pastries, pasties, that sort of stuff. And then they had cup of soups. We used to do tin soups, but we now do a substantial meal from the van now. And bread rolls, fruit, snacks, and we do have a selection of tins as well. So if people do need a desperate food parcel. Unfortunately, this problem is not going away. There will always be people coming through that are vulnerable, that are finding themselves homeless. Some people are so broken and so sad, and they don't know where to go. So we have to hold their hand and show them. They've got hope, and hope's important.